Ladies, as we age, our bodies, they go through some dramatic changes, especially as we enter into menopause. So what are the symptoms and how can we manage them a little bit better? Here with the 5 unexpected symptoms of menopause is Dr. Angela DeRosa. She is the founder of DeRosa Medical. Great to have you here. I love it when you give us these tips, because they're pretty funny, but it's also very serious for so many women. But you make it lighthearted because we're not going to die.
Nobody's going to die from a little extra facial hair, I promise.
That's right, because you said that's the first one. If we wake up and you're like, wait a minute, I have a mustache and I didn't have one yesterday. So that's one of the signs.
Well, as we move through menopause, we have fluctuating hormones, not only estrogen and testosterone. It's really the ratio between those two hormones that get affected. So we start to see hair in places we didn't necessarily want it, maybe plucking those black hairs. We get them in our nose and our ears. And also we start to lose hair in other areas where we normally had it. We don't have to shave as often, which is a bonus, but we don't have to make up for it maybe on the face.
Right. Okay, so we're maybe a little less hair on the legs, a little more on the face. We talked about some of these fun little props because these are all going to become a part of our lives. Right. And achoo, we're sneezing a lot more suddenly. So allergies may be getting kicked up.
So not only do we get vaginal dryness from estrogen deficiency, but we also get mucosal dryness in our sinus passages. So the skin that's normally plump and thick and moist becomes very dry. And that allows for allergens to seep through those membranes and create more allergies.
All right, so we might need the tissue a little more, maybe the eyes are running a little more. And mystery bruising, and that's something that a lot of people talk about. You look down and you're like, I don't know when I bumped my leg or hit my arm. What is that a
So
symptom
also
of?
when we become estrogen deficient, the collagen in our skin starts to disappear as much. So it becomes much more thin. So similarly to all the mucosal dryness, the skin gets very thin and very easy to damage. So if you bump it, it's more likely to get cut or necessarily more bruised.
Okay, so that's symptom number 3. Number 4, Visine. It becomes your best friend. Your eyes are always dry and red.
So again, we talk about estrogen. It's one of those key things that keeps a lot of our tissues, our hair, our skin, but also our mucous membrane in the eye. So it's a very susceptible area, so it becomes much more dry, it becomes itchy. It also starts to get to the point where it starts to change our vision patterns too. So not only do they become dry and itchy, we also start to have vision changes.
All right,
so get your eyes checked.
So get your eyes checked, because that could be, you know, maybe you had 20/20 before, and as you age, you don't anymore. And the memory, oh goodness.
What did you say?
I know. I'm sorry. What was that question? My colleagues will tell you I am so susceptible to this. It's so maddening because you know that you know, but you just don't know.
Very often you leave the room and you have to go, what did I leave from? Then I go sit back down, and so I think my brain sometimes is in my butt. But it's like,
I get you.
It's really an interesting thing, because estrogen deficiency leads to what I call the communication center. So the brain, that hunter-gatherer, so we talk about the gatherers, it causes all the brain centers to communicate. So when our testosterone, our estrogen levels drop, we don't communicate our centers. But also testosterone, when we become deficient in menopause, is the executive function, thinking. So that's where that memory loss, that reading information and not retaining it, you got to go back and read it 5 times in order to keep it present.
How do you get women back on track?
Well, what you want to do is make sure you do a good physical exam and that we're not missing something medically that could be causing it, but most often it's really hormone deficiencies. So we want to check your blood levels and make sure we look at what's actually happening, and then we want to optimize those hormones back and put them back into your body in the right ratios.
Okay, and doing it with you is of course the best way, because you want to be doctor supervised.
Well, you want to make sure you're doctor supervised, but you also want to make sure you're going to doctors who specialize in hormone therapies, because not all doctors are trained effectively in that, not by lack of knowledge or wanting to do that, they just don't have the training in that particular area.
All right, so go see Dr. DeRosa. She can get you back on track. If you would like to learn more about the symptoms and menopause, you can download a free copy of Dr. DeRosa's book, How Your Doctor is Slowly Killing You. You use promo code SonoranLivingSeptember at DeRosaMedical.com. DeRosa Medical, they have 3 Valley locations for your convenience: Scottsdale, Glendale, Chandler. Book an appointment by calling 480-619-4097 or visit their website, DeRosaMedical.com.